Bone grafting. You say it's much easier today than ever before.
You know, I had the greatest opportunity. I trained under the world's foremost person in bone grafting. I don't care what specialty it may be, but I trained under Dr. Robert E. Marks. Having that experience of being there and educated by him and Dr. Arun Garg, had the opportunity to see how we reconstructed jaws in the 90s and the early 2010s and to now's type of bone graft. It's evolved dramatically over the years to the point now with our membranes and our bone grafting is very simplex. It's very predictable.
And we're just to put this in context here. So you remove a tooth, put it in an implant. Is that where you're mostly putting the bone graft? Is for extractions?
Yeah, for almost every extraction,
Okay.
we recommend bone grafting,
Okay.
which I wasn't necessarily a big fan of 10 years ago. But now data and the techniques and the materials we have now is more perfected. We understand it better. We're putting bone grafts in everybody. So it's really simple. Most patients don't even know we placed the bone graft unless I told them we did.
Is that right?
Yeah, they don't even know unless I tell them.
So is it from what? Like bone building material, synthetic?
You have four types of bone, Randy. You have autogenous, means it comes from you. Allogeneic comes from a cadaver. Then you have a xenograft, which comes from a pig, horse, or cow. Then you have an alloplast. The one we use the most is either bovine or porcine, which is pig or cow. The reason we use that is the closest thing that resembles our bone. And the reason we want something that resembles our bone is that kind of like a beanbag, Randy. If we sat on a beanbag, it would squeeze it, right? But we have to have the right particle size. It's important to have the right particle size because if it's too small, it actually migrates away. If it's too big, your body can see it as a foreign object.
Okay.
So having the right mixtures allows capillaries to grow in and out of it to lay down bone. So all it really is a scaffolding to allow your bone to weave in and out of it and allows us to help preserve that. Because as we said earlier in the show today, that the national average is about 23% shrinkage. By adding that bone, we help retard that process of shrinking.
So it's nothing to worry about, like not added pain or things like that?
You won't know even I did it unless I told you.